Now, you know, over the past couple of weeks, we've been taking a look at the many different aspects of pregnancy, and I've actually received quite a few questions from you asking me, Kia, now when exactly are you going to be giving birth? And I have to say, as the time is drawing closer, I'm getting a little bit on the nervous side. I don't know exactly what I'm supposed to be packing, what it is I'm supposed to be doing, and I've been asking so many different people for advice. Now, no, at the moment, my guest is actually busy being mic'd, and of course, she is going to be telling me a little bit more.
I was actually calming her down, because, you know, being on a live show is actually quite something pretty hectic, so you can come with me right over there, and you can be on the green chair. I'll pull it out for you. There we go.
Oh, he's such a gentleman. Don't you love him, Natasha?
Absolutely.
He's absolutely brilliant. Kat,
there you go.
Yes, I'm going to hire one of you at my birth, okay? Definitely. Well, good morning, Natasha, and thank you so much for joining us. Of course, you are a midwife, so you know exactly everything that goes into, you know, the birthing process itself. Now, how exactly can I prepare myself mentally for this time in my life?
Sure, that's quite a question, Kia. I think the most important thing is that birthing is something that you never really can prepare for.
Right.
But birthing is also not meant to be negative. It's meant to be a positive experience. So you need to trust that your baby's going to be fine and that you're going to be fine and that you're actually going to be able to give birth to your baby, just like many women have done before, and feel absolutely wonderful afterwards.
Lovely. Now, you know, a lot of people have been telling me, you know, exactly what's happening to my body. There's different changes going about. What exactly is going on inside as my body's preparing for this birthing process?
Your body's changing continuously on many different levels. The hormones obviously being one which nobody
don't tell me about those hormones, girl. I know. Yes.
I think the main differences that happen in the last trimester is that your relaxin causes your muscles become a little bit more relaxed, and the ligaments in your joints become more relaxed so that your pelvis can move during birth.
Right.
Your baby is obviously carrying lower, so you probably feel a lot heavier.
Yes, I do.
And one of the most obvious to the moms often is what we call the Braxton Hicks. So it's this tightening of your tummy like a soccer ball almost, and relaxing. It's your uterus training and getting the muscles ready to work later.
Wow, that's pretty interesting. Now, I've been asking the viewers out there if they have a couple of questions, and I actually got a question on Twitter. And this question is from Taryn Long. She asked, how long after a previous Caesar is it safe to try VBAC? What exactly is VBAC?
Okay, VBAC is a vaginal birth after the previous cesarean section.
Right.
And it's quite common. We do it quite a lot these days. There's no research on that, and obviously everybody's different. But judging what you go through in pregnancy and the changes that your body undergoes, I would say about a year, definitely.
About a year.
Some people would say 2 years, but there is actually no research on something. But the body will need about a year to recover from a previous C-section.
Because it's like an operation that you're having.
It's an operation, but you're also looking at the hormone levels again, at the weight gain and loss, and just to get yourself feeling strong again and ready for another pregnancy on the whole, whether you have a VBAC or have had a previous natural birth or a previous C-section.
Okay. Now, medication. I have heard that there's so many different types of medications that one can try when you're opting for the birth. I have to say, it's confusing me so much. I don't know what to do.
There's actually not that many medications we use. The main medication that most moms are concerned with are pain medication. They don't really want to know what vitamin supplements we have. I think the most important thing to realize is that birth is very much a natural process. So any intervention in the natural birth process has to prove valuable. It has to make more sense to intervene than not to intervene. So your different levels of pain medication would be your gas that everybody talks about, and that doesn't actually take away your pain. It just makes you a little bit duller. So that also affects your bonding and your alertness after birth, obviously, as well. And then your pethidine, which is an opiate, which is going to affect you and your baby and make you very sleepy, but also, again, is not going to take away all your pain. And then the only real pain friend that we all know in birth is your epidural.
Yes, that's the one I'm having.
Okay, and then your epidural is great if you have a long, sort of an abnormally long birth.
Yes.
But for a healthy mom, your epidural actually takes away all the feeling in your lower body, so you can't feel what your body is doing. So the chances of you actually having a vacuum or a forceps delivery or intervention in your delivery is far higher when you have an epidural, because you're not able to actually work with your body.
That's interesting. First time I've actually learned about that. Wow, it just shows I am learning now. And we actually had a Facebook question as well, this time from Marita van der Merwe Schulzer. She's asked me if I have a birth plan, and like, you know, well, I've been mentioning to a lot of people, I'm going for natural birth. What is the best way? Water birth, normal birth? What about the painkillers? Now, we've kind of touched on the painkillers, so I think, you know, what do you think is the best way to opt for birth?
I think the mother needs to be comfortable. That's the most important thing. Your body produces endorphins and actually does a lot to manage its own pain and do its own pain relief. Your head does a lot too. Just trusting that you can birth and trusting the people that are helping you is going to help you go through your birth. I do a lot of water births. And I love water. I think as a place for moms to relax.
Very relaxing, yeah.
Takes the weight off, helps moms deal with the contractions a lot better. I do a lot of water births. The babies are peaceful, they are happy and quiet. So I have to say my personal preference would be a water birth. Yeah.
Now, I had a bit of a false alarm a couple of weeks back. I had landed up in hospital. Probably had one of the Braxton Hicks type of scenarios happening to me. And I saw a bath in the room and I thought, is this where the actual water birth takes place? Or is it a totally different type of scenario? How would one define a water birth?
No, normally, if your birthing facility has birthing pools, they're in the labour ward.
Okay.
So they're not separate. And you get in and out of the pool. You don't stay in the water all the time. So some moms use the water just to relax and they end up not giving birth in the pool. And other mothers actually give birth in the pool.
Right.
So I think it's very much up to the mother. The mother has to feel comfortable. And also some babies actually need the weight of gravity to come through properly. So if you wait too long in the bath and you say, okay, come on, let's go for a walk and do something.
Oh, mom's having a party over here, yeah. Well, lovely stuff. Now, okay, I have to ask you a couple of questions. I am flabbergasted. Don't know what I'm supposed to be packing in my bag. I've actually decided to go for like a really whole big lot of nappies. I don't know how much I'm going to need when I'm actually giving birth and baby has arrived. Is this a bit overkill?
Look, nappies are never overkill because in the next 20 years, you're definitely going to go through them. I think the most important thing to remember is that if you're going into a private facility, the hospital will supply you with quite a lot of your basic baby stuff.
Yes.
The other thing is you are in a civilized area. You can go to the shop and you can send your husband or your partner to the shop if you have forgotten something. So don't worry about packing too much. Just the basics for yourself and the basics for babe and the things that you like as well. Your toiletries, your sponge, your own shampoo.
Well, speaking about things in the bag, for the baby, I actually packed a little blanket, which I thought was quite cute. It's got a little lion on it. And then I've also got these wipes as well, just in case I might need them. So I thought this would be something great to get as well. I've got little booties. Oh, these are so cute. They're like little tiny little feet. Oh.
That even goes back to my kids.
And obviously something to clothe the child with. And I've actually got a little... you know, sort of all-in-one jumper, which I thought was absolutely cute. And yeah, that's... yes, I am having a girl. So, I mean, is that sufficient enough for baby? Because then I'm thinking we're going to take a look at my bag. Now, I do have, because I believe that after you've done, you know, with the birthing process, you do have to get sanitary towels as well. That's very, very important. I've also gotten myself, I mean, this is just a little very relaxed and comfortable little rookie that I got for myself because I need to make sure, obviously, that I'm at my most comfortable. Besides getting, you know, myself the sanitary towels, I mean, what else do I need to be including in my bag as well?
Okay, I think most of your baby stuff the hospital will have. Okay, the two things you want to have at home for your baby is your surgical spirits to clean the cord with later.
That I didn't know.
And I often use Wesson powder or wound powder for the cord as well. So those are two things you're going to need.
Powder?
Wound. It's called
wound powder.
Brazen wound powder, yeah.
Interesting.
So you don't need anything else really for baby at this stage. And then the important thing for you is your, as we said, your sanitary wear, which should be appropriate. I always suggest an ice pack or two. Which is, obviously, there might be swelling or what have you, so it's very comfortable to have,
another thing I didn't know.
And what you can do as well is you can take your sanitary wear and you can actually wet them and freeze them with a bit of lavender oil or something on there as well, so that would work. Your own creams and toiletries, I think that's often a problem.
Yes, I've got my little shampoos and everything and my wash stuff and all of that inside there as well.
And your vitamin preparations like you were taking at home.
And then I'm set.
That's it. You're set.
Voila. Excellent. I wish it was as easy as that because my nerves are completely shot. But Natasha, thank you so much for joining us in the studio. I'm sure that you've taught a lot of other mothers out there who are expecting at the moment exactly what they need to do as they prepare themselves for the birthing process. And then I've also got a Twitter message from Zungu who says that she is due tomorrow. Zungu, I just want to say congratulations, and we are all thinking about you here at Expresso. Now, I believe it's over to Liesel. We're going to be learning a thing or two about heartfelt crafts. Let's take a look.
Stay with Expresso and SABC3.